And now, please welcome to the stage Foreign Policy Pentagon and National Security reporter Jack Detsch for an interview with Dr. Raj Panjabi, Special Assistant to the President and Senior Director for Global Health Security and Biodefense for the White House National Security Council.
Thank you so much, everyone, for being here at FP's Global Health Forum. Dr. Panjabi, obviously you've been introduced, but I'm curious, we're sort of in this era where we're working on global public health, and there's a competition with China going on, of course, that the president has talked about a lot in strategy documents. I'm curious how you sort of straddle those two objectives from where you sit. Both this post-COVID cooperation that there is with China and also the geopolitical competition.
Thanks, Jack. In the national security strategy, which was released in the fall of 2022, there's both a focus on strategic competition, and then there's a focus on having strategic collaboration on transnational challenges. One of those transnational challenges, like climate, is on ensuring a safer world, safe from infectious diseases and other biological threats. So there's a focus on actually ensuring we collaborate on this transnational challenge of global health security, ensuring the world's safer from the next pandemic, for instance. And one good example of where there's been that collaboration has been around the pandemic fund. My friend Juan Pablo was just up here. The World Bank, working with the G20, launched last year, something the President Biden called for on day one of the administration, a pandemic fund to help low and middle income countries prepare for and respond to the next pandemic while strengthening their local health systems. And that was something China has also invested in, as well as the United States, along with a number of other partners.
I'm curious about sort of the preparation for the next pandemic. We seem to be a little bit over the phase of vaccine diplomacy, as we were talking about backstage, but I'm curious about your thoughts of what's still to do in the field of vaccine diplomacy for the United States, and how you manage the supply chain competition, perhaps on the pharma angle with the Chinese, and also how the U.S. and China are both seem to be investing in infrastructure, in pandemic-related response infrastructure in the global South. How that's going so far?
Well, first and foremost, our vaccine diplomacy was no strings attached. The U.S. has put forward donations of over almost 700 million vaccines now to 116 countries. There's more supply now than there was a couple of years ago when I was serving on the front lines in Boston. We have still requests coming in for those vaccines, and they're still free, and there's no strings attached. We've also provided, the United States has, of the some $34.5 billion of financing provided globally for COVID, the U.S. has provided about $17 billion or $16.5 billion in addition to those vaccines that we've provided. And then the other big focus for us is, of course, ensuring that we don't take our eye off the next variant and the next pandemic threat. And so the president, in the national biodefense strategy that was launched in fall of 2022, think of it as the nation's comprehensive plan to prevent, prepare for, and respond to the next pandemic and biological threat. The U.S. put forward a commitment to work with other countries, in fact, 50 of them by 2025, more than doubling the number we've already been working with, to invest in local health security. And that's investing in local public health workers, it's investing in labs, it's investing in the capability to deploy vaccines more quickly the next time. So I say all that in the context of your questions around China because our leadership is consistent with our values. And that is focused on working with democracies, ensuring free societies, ensuring that public health is equitable, healthcare is equitable and accessible. And there's a commitment to do this over the long term. And I think you've seen that in numerous summits that the United States has held, most recently the Africa Leaders Summit in December, where there continues to be an inequity in access to vaccines. And so the United States has really worked closely not only to help those countries access vaccines, but hire vaccinators to reach rural, remote communities, to reach the highest risk. And we're starting to see some of the results from that. You know, globally, some 70% of adults have been vaccinated with a complete primary vaccination series. But we still got more work to do to make sure those who are elderly, 60 and above, are vaccinated, that they continue to get access to those vaccines, and that we continue to rebuild the primary healthcare systems that ultimately we depend on to do pandemic response.
And we talked a little bit backstage about decentralizing manufacturing so countries can have some of this infrastructure on the ground. Could these countries be players, perhaps, in dealing with the next pandemic themselves?
Absolutely. And this is something that, at the Africa Leaders Summit, the Africa Union has brought forward. This is something that they've made a commitment to, that in the next 40 years that they plan to go from purchasing just 1% of the vaccines they use today in Africa to having much more of that purchased in Africa. And that's something the United States is very committed to work with others to help them achieve. There was work, of course, during the COVID, the emergency phase of COVID, to ensure that sites in South Africa were able to produce vaccines. Of course, it became more challenging for those vaccines then to have a market to be bought. So we've got to fix both the manufacturing, the production, but also ensure that we're buying more of these products from within low and middle income countries, not just when acute pandemic happens, but the everyday epidemics and pandemics we're dealing with, HIV and AIDS, malaria. You heard from my friend, Dr. David Walton earlier. Both he and Dr. John Kengasong, Ambassador Kengasong, the head of PEPFAR, have been working on initiatives to ensure that more procurement of not only vaccines, but tests and treatments in those cases is happening locally. That can help set up the kind of ecosystem we need locally that can then be scaled and surged during a response. And we've seen how important it was, the investments we'd all made together in India, which became such an important part of ensuring that other countries had access to vaccines, because so much of it was produced there.
Talk to me a little bit about, now that we're sort of through, of course, the worst of COVID, what you think the next pandemic looks like. And you've talked a little bit about some of the strategy documents the administration has released, the National Biodefense Strategy, of course. What does the playbook look like for the Biden administration right now?
So think of the National Biodefense Strategy and Plan as something Congress mandated, the administration has put forward, and as the nation and contribution to helping end the pandemic threat as we know it. And what does that mean? That means we've got to be faster in detecting these epidemics and pandemics. We've got to be capable of preventing them, whether they come from naturally occurring, accidental, or deliberate causes. We've got to be more prepared in rapidly responding with vaccines, tests, treatments, PPE. And then we've also got to be much more coordinated in the way we respond. The biodefense strategy calls for achieving global health security as well. And a few of the outputs from that strategy just in the past year that it's been launched has been focused on putting a plan together for helping us get vaccines not in 300 days, as remarkable as that was, but within 100 days of a severe pandemic. Ensuring that those vaccines then are available not just here in the United States at scale, but that we work with other partners around the world to ensure that they're available in about 200 days or less to any at-risk person in the world that wants to take a vaccine. We've also been working on the response side to be much more effective and efficient in the way we respond. So when we have an outbreak that could become a pandemic, we're much more forceful, coordinated, working with the local governments to respond. A good example of that was in the fall when we've had about 4 viral hemorrhagic fever outbreaks, Marburg, 3 outbreaks, 2 of them just ended in Tanzania and Equatorial Guinea. There's also the cousin of Marburg, Ebola, which is more well known. We had an outbreak of a different strain of Ebola than we typically do in Uganda in September, October of last year. That outbreak was brought to an end in part because of the local health workers there, but because of the coordinated response of the US and others, brought to 0 cases within less than 100 days after it was thought that may spin out of control because it doesn't have, that particular strain of Ebola doesn't have an approved vaccine or therapeutic. So that kind of response, efficiently, effectively, is the kind of thing we need. And as I look at future pandemics, we've got work to do on the ones that we're dealing with today: HIV, malaria, tuberculosis. We've also got to be prepared for the next respiratory transmissible pandemic, whether it's a coronavirus or, of course, these viral hemorrhagic fevers, which have less pandemic potential but can spin out of control and cause massive regional epidemics.
You talked a little bit about the state of the vaccine industrial complex, for lack of a better word, I guess. We're in a situation now, of course, where there's more supply of COVID vaccines than demand. And when you talk about, I guess, the 100-day to 200-day push to produce a vaccine for the next pandemic, do you assess that the U.S. is ready to do that, that it could take the moonshot?
If Congress can meet us in terms of appropriating more finances, funding to be able to put the investments we need, then we can get there. It'll take several years, as we shared when the biodefense strategy was announced. But is it scientifically and technologically possible to do it? It is. That is possible, but we do need the resources to get there. So are we ready to be able to do that today? No. Do we have a plan to get there in the coming years with the right resources? Yes.
So the budget talks and fights with Congress are the speed limit here.
Right. I mean, there's in 2022, according to our Office of Management and Budget, there was about some $10 billion a year spent against this biodefense strategy. Congress enacted more funding in FY23 as part of the annual appropriations, and there's more that's been requested in the FY24. So that is in fact a enabler or limiter of what we can do and when we can get it done. But that is, look, my argument to anyone working on this, of course, as a doctor, there's a moral argument. Lives are incalculably valuable. Anything we can do to protect anyone here and around the world is going to be good for them and the safety of the world. But there's also an economic argument to be made. There's an analysis done last year out of Imperial College that showed, and 20 finance ministers, cited this when the pandemic fund was launched. For every dollar invested in pandemic preparedness, just looking at U.S. numbers alone, if there was a COVID-like pandemic again, some say that risk is as high as 50% in the next 25 years. Some modelers say that. But if it would, for every dollar invested in pandemic preparedness, we can save $1,100 in averted GDP loss just in the United States alone. And that's not a theory. I mean, we just have experienced the trillions of dollars of loss here and around the world. So it's worth doing this because it actually has a high return on investment.
And if the resources aren't allocated, is there a risk of ending up back in a March 2020 situation where there's not the PPE, there's not a path to a vaccine potentially?
I think we're better prepared than we were prior to this pandemic, the COVID-19 pandemic. That's for sure. And you can see multiple signs of that. One of the things we've done, in addition to investing in products and trying to be faster in scaling up vaccines or tests or treatments and PPE, is to invest in people. The United States put out in the American Rescue Plan, with the support of Congress, some $3.2 billion over the next 5 years to 107 jurisdictions in all 50 states to invest in the local heroes at the local public health departments, epidemiologists, data scientists, community health workers. So we're better prepared than we were, to answer your question about March 2020. But we've got more work to do to get ready for the next pandemic.
We're starting to run a little bit short on time, but quickly, if you can summarize, Dr. Panjabi, you've been at the crosshairs of two of the biggest pandemics, of the past several decades, of course, malaria and COVID-19. I'm curious what you see from your work at the WHO and in the Biden administration, some of the key lessons learned there.
I think of it as the 3 E's. We've got to be more efficient. We've got to be more rapid in, say, detecting these epidemics and pandemics. Investments in technologies like wastewater surveillance are going to be as important as investing in community health workers in parts of rural Africa or in the United States, where they can detect these events early, counter misinformation, disinformation. The second thing we've got to do is to be more effective. We've got to be more focused not just on stopping transmission, but preventing morbidity and mortality, that is suffering and death. And that's whether it's a viral hemorrhagic fever outbreak like the one in Uganda with Ebola, or it's COVID-19. And the third thing we've got to do is we've got to be a lot more equitable. And I think that work has to be done every day. And it's got to be closing the gap between rich and poor, between powerful nations and those that have less resources, between black and white and brown, between rural and urban. And so I think if we can focus on efficiency, effectiveness, and equity, we've got a roadmap to be able to change the pandemic threat as we know it.
We're going to have to leave it there. Appreciate it, Dr. Raj Panjabi.
Thank you.